weren't just chasing a rank, they stayed steady when it got hard. They breathed through the doubt. They rested, recharged, and rose. They kept their vitals intact. Today, they don't just rank, they embody the rhythm of resilience.
We are live. Good evening, everyone. So, NEET PG'25 result has been announced, and I am extremely happy and proud to share the screen with Dr. Pooshan Mohapatra, who has scored rank 1 in NEET PG 2025 exam. Dr. Pooshan, heartiest congratulations from the entire team of DBMCI on securing rank 1. I mean, that's the uppermost dream that you can have. Heartiest congratulations.
Thank you, sir. Thank you so much.
So before I say anything, tell me that what was the first reaction when you saw the result, or who saw the result, and then you saw rank 1?
So I saw the result myself, and my mother was standing beside me. I could not believe it. I was telling her to see this is correct or not. Then I called my sister and I asked her to check. So,
and Dr. Pooshan, your
checked
score
it
is
like
707 out of 800, right? So, and when everybody was saying that the paper was very easy and the topper will get a score of 750 and so on. So what was, I'm sure that you must have seen some recall left and right. So you must have a decent idea that what you are. So before getting the result, what was going on in your mind, that what will be your rank?
I had seen so many polls and so many like things that were saying that 1,000 people will get over 180 and all that. So that was, I had thought कि इस बार तो अगले बार के लिए थोड़ा पढ़ना पड़ेगा शायद, because I was getting 170 175 correct sure questions, and I thought maybe let's see what happens with the result, and then this happened.
So this is what we keep on telling to the students, that more or less the result remains same. So Dr. Pooshan, heartiest congratulations. So happy for the students who are watching this interview. Dr. Pooshan was with Dr. Bhatia Medical Institute in our TND program at Bhubaneswar. He was a face-to-face student with TND program in Bhubaneswar. So Dr. Pooshan, you get rank 1. It's all because of the hard work. But I always believe that there are certain people in the life that you want to thank. So let us start this interview by thanking those people. If you want to give any credit or any regard to any of the people who have played a role in your success.
Firstly, my parents, obviously, they have supported me. They have. I stay at my home. I've stayed at my home throughout my UG as well. So the environment that I got in my house, and my sister, who is also a doctor, she used to guide me. Like I used to give GTs and I used to send her the scores, and I used to ask her, "Ye kya karna hai? Iske kya karna hai?" And that was very helpful. And then I had a couple of friends who, with whom I studied. Like I used to keep track with.
So for the viewers, this was the first attempt of Dr. Pooshan. He was an intern. He finished his internship in March from SCB Cuttack. And this is the first NEET PG exam that he wrote. So Dr. Pooshan, you were pretty decent in your studies, and we were talking back screen, and you told me that you were very regular. And nowadays, the content is available at a click of a button. You have attended, you have already spoken to Marrow, and you have attended a lot of lectures at Marrow. What is the role of guided learning? You joined TND program with us in the internship. Internships are always very hectic. So what was your reason of joining a TND program in the internship? Why do you think it is necessary? Why do you think, in spite of having availability in the form of a convenient recorded lectures, it is important for the students to have a guided learning? What was the role that DBMCI played in your preparation? Let's discuss all those.
I think my personal reason to join a TND course was to start studying, like to fall into a schedule so that I would read a subject in a week and then give a test to assess myself. And also secondary reason was when you're sitting in front of people and you're seeing that this is my competition, there you're sitting beside them and you're seeing these people are scoring so much, they are thinking in this way, that I think inspires you a little also. So I think face-to-face classes work, that's one of the advantages that I thought I would get, and I did get in the TND course.
So for all the viewers, I want to specifically emphasize this, that in this world nowadays, knowledge is available at a click of a button. Gone were the days when your medical knowledge was dependent on your medical college. Any student who want to study has plenty of resources which are available. But what differentiates students are discipline, right? There are certain students which are inherently disciplined, but there are certain students for which discipline is needed. Then some of the time in your busy schedule, even if you are disciplined, you need a guidance. And for the students who are well disciplined in MBBS, internship is a time when, irrespective how disciplined they are from within, they need a guided learning. And that's a time when the students who are well studied, a TND program plays a very very significant role. And Dr. Mohapatra has proven it. He has shown this, that even with the hectic internship, if you focus, you are able to reach to the highest possible area that you want to achieve. So Dr. Pooshan, tell me specific areas in the DBMCI that that you feel has changed the path of your learning and were able to help you in reaching to this dream that a lot of the students are dreaming at this time.
So first of all, it gave me a peer group that I could compare myself during those days that I was attending the classes, and also the questions that were discussed. The way you attempt questions, that is also very important, and the discussions that happened around the question, that opens up your mind a little to answer questions that you actually don't know even in the examination. So I think that was one of the biggest things that I got from the program.
Yeah. Any specific difficulties that you want to mention, Dr. Pooshan?
I had attended your class, and you are one of those teachers who specifies कि ये सोच सकते थे, ये कर सकते थे, and I loved your class. Even with radiology, you were discussing other subjects.
Dr. Pooshan, let's try to talk about, let's say that you have a younger brother who is in a final year MBBS and who wants to come to this stage and talking to me after 2 years. Tell me, what will you advise him?
I would ask. I would say stick to limited resources. Don't go for everything that's there in front of you. Decide कि ये करना है, and then you stick to it. And also do questions along with whatever you are watching, whatever content you are watching, whenever you are watching. Not just in your internship, not just when you are preparing. Also, if you are in your second or third year and you are just watching videos, do questions. That helps. And towards the end, you need to concise whatever notes you have, whatever resources you have. You have to mark and you have to concise and read a little in a focused way. I think that's very important, because 19 subjects and the depth that is there in each subject, it becomes very very overwhelming. So I think
okay, tell me specifically, Dr. Mohapatra, when you are preparing for the exam, all days are not same. There are a lot of time when you are at a very very low mood, when you know that I do not know what is happening with me and I am the last person who will be able to get a rank that I'm looking for. How have you handled those times?
I think talking with someone helps if you're preparing with someone, I was lucky. I had a sister who has already cleared this exam and is doing her PG, so I could ask her. If you could ask any senior or anybody you're preparing with, I think that helps. And also like believing in yourself. I think even on your bad days, I had a bad GT just 2 weeks before this exam. The last serious GT that I gave, I got a dip, and big dip. So just believing that yes, I'm doing the efforts, and I'm overall I'm getting I'm going on the right path, that helps a lot.
And as you have mentioned, that try to limit the resources. I rather put it in a different way. I say that try to put the food in your plate that you can eat. That is
Yeah,
how
yes,
I normally put it, that there is no limit onto the things. You just put the
yes,
things that you can eat, and once you're able to finish that food, then try to go to any other area, and then try to put more food into your
yes,
this. But how do you handle that FOMO? How do you handle that the people are reading left and right everything? People are concising it in four ways. So how that problem you were able to address? Because till the time you get such a rank, you can't you can't be so sure that you will be getting this rank. So how you were able to
yeah.
handle that point?
I think your personal progress is the best thing that you can see. Like you give GTs, and you're seeing that yes, I'm getting things correct. I'm getting more number of corrects. That's one of the ways. And also, like even if you're getting the same number of corrects, you're getting hitting a plateau. Uh, if you're getting questions correct by knowing them, that's better. Like in the first, suppose I got 140 in two GTs continuously, and in the first GT I guessed a lot, and in the second it was more like I know these topics, then that was progress for me. So I think tracking my own progress was the best thing that I felt to shut out.
Dr. Pushan, since a lot has been talked about the test and discussion program, you also joined
Yeah.
because of that. So I will ask you three questions now. The question number one is that do you think TND programs are useful for the students? And which group do you think TND programs are useful?
Yes, it's definitely useful. I think I was an intern, so I could not. I For me it was a little more bit more hectic. Maybe someone who has a little more time, that is even better. But as an intern, I did not focus on attending every single class because there were duties I had to miss. But following the schedule was more important for me. So
So basically, you want to say that it gives you a discipline that you can follow a schedule,
yeah,
and obviously it gives you some pressure that okay, there is a test that is happening.
yes,
I have to prepare my subject before that. You have a test available. The
yes,
test tells you the way that the questions have been prepared, and if the answer is wrong, where it is going wrong in your mind, and
yeah,
then working on them. In contrast, when it's not a discipline, then when the internship goes hectic, then you tend to delay the things, that okay,
yeah,
chalo, मैं बाद में कर लूंगा, and we always say tomorrow never comes. So that's the biggest advantage that
yeah.
it gives you, right? So um, do you think that okay, now I'm taking the doubt that the students have asked me, do you think that attempting GTs help in preparation, and do you think that PYQs help, and do you think PYQs is the only thing that helps? What is your view on this?
PYQs is not the only thing you do, but it certainly gives you the direction where you have to go. It's more like PYTs. You see the PYT and you go to the depth. Even the questions, if for every exam comes like that. And GTs, yes, GTs. I gave the two GTs initially when one GT every 2 weeks when I started off. Then it increased to one per week, and towards the extra months that I got after June 15th, I was trying to give about once every 4 to 5 days, and reviewing them helps you in the preparation. Like not just giving the GTs, but also reviewing them.
Okay. So, the message is very, very simple for the students who are into MBBS, that the earlier you get disciplined, the better are the chances of the success. If you have done your theory pretty well during your MBBS, and even if your internship is hectic, you can dream for a single digit rank. All that you have to do is you have to remain disciplined in the internship. If you are not able to remain disciplined, then that is an area where the challenges is gonna come. So try to remain disciplined. You can join TND programs. They keep a check on you that you are able to finish your revision in a given amount of time. Then test tells you that where do you go wrong, and backing it up with the discussion with the teacher helps you in getting refined in your preparation. Keep on writing the GTs, identify that again where are you going wrong. If you get bad days, don't worry about it. There will be always some bad days, some good days. Don't lose belief on you, and I'm very very sure that if you remain disciplined, if you remain focused, you will be the next guest in these interviews. So congratulations, Dr. Mohapatra, not just to you, but to your entire family and to your loved ones. I'm telling you that it's not just you, your entire family and your friends. They are extremely proud of you. We at DBMCI are extremely proud of your achievement, and may God bless you all in all the endeavors that you do. Thank you very
Thank you
much
so
for joining us in this interview, and
Thank
once again, a big congratulations.
Thank you, sir.
The journey doesn't end here. Keep your rhythm, hold your balance, breathe, reset, rise.